The next technique we're going to demonstrate is for use of terminating a baby that would be in the second trimester. This would be a baby just like Samuel Armas. Remember we talked about how Samuel had had the surgery done on his spine when he was still inside the womb. Well, that's the gestational age when this procedure would be performed. This would be performed between about 13 and 23 weeks along. But again, the techniques for the beginning part are very, very similar. We use the speculum. Speculum is then placed on the inside in order to give visualization of the cervix. And because the role of the cervix is to keep the pregnancy on the inside, we have to use the single-tooth tenaculum to hold and control the cervix again. Then we start again with our dilators, like this one, starting small, working our way up to a larger dilator because these babies are further along. And sometimes we have to use something called a laminaria. And the abortionist would place a laminaria, which is a very thin, dried stick into the inside of the cervix, maybe the night before the abortion, which would then have time to swell, absorb moisture, and dilate the cervix even larger for a more advanced development baby. But then the next thing that's done is the baby is too far developed, the bones are too strong, the skull is too strong, all these developing limbs and growing parts of the baby are just too resilient and too strong to actually be sucked through a tubing. So this is what will then be done. This is called a dilatation and extract, or a D&E. I want you to look at this particular set of forceps. If you can see those teeth are kind of like shark's teeth. They all point backwards. The reason they point backwards is so when they grab something like my finger, I can pull pretty hard and it's not going to slip out. You can probably even see some of the little grooves that it left in my finger. What this particular forceps does is, with an ultrasound guidance, as this is being introduced up into the cervix and up into the womb, the abortionist would look up on the ultrasound machine and would be able to guide this instrument, and whatever they see first is what they would grab. And remember, the baby is still alive, baby can still feel pain, and the baby is just as far along as those pictures you saw of Samuel Armas when he was getting his spinal surgery. But this is then used to grab an arm or a leg, and then once a firm grip on that arm or that leg is obtained, literally that arm is pulled off of the baby's body, or that leg is pulled off the baby's body, and that will kill the baby. Then the ultrasound is used to guide this instrument to remove the abdominal cavity, the chest cavity, and sometimes the most resistant thing to the abortionist with the baby is actually the skull. And sometimes the skull is just too developed to actually bring out easily. So a forceps like this is used to guide up around the baby's skull, and then once it's grabbed with ultrasound guidance, this is then used to crush the baby's skull, and then that crushed skull can then be removed. Then the same suction would then be used to remove the placenta, which is going to be left there on the inside. And then once again, this will be used to scrape the lining of the uterus of all the other blood clot and things that would be remaining on the inside. The abortionist would then look at everything that he's brought out. He'd look in, actually would on a stand like this one over here, would take all the parts that he's brought out and literally reassemble the baby to make sure that there were two legs, there were two arms, there was the skull, there was the chest cavity, and the abdominal cavity. And once he's realized and reassembled the baby there on the outside, the abortionist then realizes that he's gotten all the parts out from the inside. And don't forget, not only can we see these babies really clearly on ultrasound, diagnose abnormalities on these babies on the ultrasound, but this is when we can also treat these abnormalities of these babies on the inside. Yet just because somebody chooses, a baby can be aborted and can be terminated at this second trimester gestational age.